The most common presentation for somebody who presents with knee pain is secondary to osteoarthritis. Osteoarthritis is basically an inflammation of the joint secondary to the cartilage wearing thin, and you have friction, basically bone rubbing on bone when it is at its most severe. And when we treat those patients, we generally want to decrease that inflammation and help their pain and range of motion. There are different treatments we can perform for osteoarthritis of the knee. We can inject steroids, which can decrease the inflammation, and we usually add an local anesthetic to that injection to help decrease some of the immediate pain. A second type of substance that we can inject into the joint is known as viscosupplementation, and there are several different types, but basically it lubricates the joint and regenerates some of the fluid into the joint and helps the patient maintain more functionality as far as ability to walk, stand, bend, move the knee for longer periods of time. Generally, those procedures do need to be repeated every 6 months to a year. Another procedure that we can perform for patients with chronic knee pain is called a geniculate block and geniculate denervation. There are three main branches of nerves that go to the knee, and there's a fourth one on top of the knee. And we inject those with anesthetic. And if the patient responds significantly well to injecting that anesthetic, we can actually denervate the joint. And we do that with radiofrequency energy through a tiny needle that we place over the top of each nerve. We have a special machine that can find the nerve, and when it finds the nerve, we anesthetize it and then heat it for about 90 seconds. And then those nerves fall apart over a period of 3 to 4 weeks. And the hope is generally the patient will obtain long-term relief from these procedures. The nerves eventually do grow back, and over a period of time, occasionally they have to be repeated, but not always.